Welcome back to the AUA Inside Tract podcast. My name is Steve Hudak, Chair of the AUA Young Urologists Committee. Today's episode features Dr. Damara Kaplan presenting her perspective as a private practice urologist on the top 10 things I wish I knew before I started practicing, from a panel discussion at the Young Urologists Forum at AUA 2019 in Chicago.
Hi, thank you for having me here today. So I have a little bit different perspective than Dr. Riley, and I'm going to talk about 10 things I wish I knew when I started practicing. So this is just a little bit of my practice highlights, like why am I up here? So before I went to medical school, I got a PhD in renal toxicology, and I was a really good rat surgeon and a really bad rat anesthesiologist. And I realized that I wanted to contribute more than just research. So, finished medical school, did my urology residency. I'm a little bit of a pterodactyl here. I was in solo private practice for 3 years. We then came together and formed a private urology practice, and the number of people in our practice ranged from a high of 7 doctors to a low of 4 doctors, which sort of leads into my disclosure. I'm now actually a hospital-based doctor. It's only been 9 months, but I'm going to talk about the private practice aspect. In addition, I've been involved in many aspects of organized urology. In the AUA, I serve on the history committee and the medical student curriculum committee. I'm also the South Central Section AUA Board of Directors Alternative. In the South Central section, I've been the past president, I'm the current historian, and I've been the past New Mexico state rep. And I currently serve as the AACU Secretary-Treasurer and past South Central Section representative. So, 10 things I wish I knew. So, when I first started out, the first thing that I think you really need to know is how to code properly. This is vital for survival in private practice. Generally, it's not covered well in residency or even at all, and this is the thing that you really need to know. So this, I think, you've got all this time between finishing residency and starting your job. What do you need to do? You really need to figure out how to code. And there are various things that you can do. This doesn't sound particularly interesting, but it's vital to survival, is to take a coding class. It's a good use of a weekend. The AUA puts on classes, and there's another PRS network that's specific for urologists in urology coding. I would definitely do something like that if possible. When you get to your practice, work with your office coder. They can help you, to the best of their ability, figure out how to code things, learn who's coding your surgery, talk about things that are going on with clinic coding. You can get in trouble with the government for both overcoding and undercoding. And if your practice gets dinged and you get audited, your practice can be on the hook for a lot of money. The other thing is to visit the CMS government website. This really sort of lays out the basis of E&M coding as the government sees it, and then sort of each individual discipline co-ops what they're doing from there. So learn how to code. Next, how insurance works. This is an exceedingly complex topic, and I don't think anybody's going to think that you're going to be an expert on the ins and outs of insurance. But I think that you really need to understand the differences between your private payers, what happens with Medicare patients, what happens with Medicaid patients. You have your TRICARE patients, and then, at least in our region, your Indian Health Service patients. Because they're all sort of little different quirks between these two, and if you understand why something works in one setting but not in another setting, I think that's critically important. So, get to know your local payer mix. As Dr. Riley alluded to, New Mexico's kind of an odd state. Probably 49% of our covered lives are covered through Medicaid. You will figure out in private practice how this is going to affect you, and I think that this is critical. So how do you learn about insurance? Talk to the practice administrator that you have. If you have questions, and if they are worth it, they will be able to tell you why this works and why that doesn't work. Once again, talk to the billing staff. I mean, it may seem kind of odd to go talk to somebody in this office around the corner, but they will help you figure out the ins and outs of the various insurance and why for TRICARE you need to have, referral. IHS, you've got to have a referral or you can't see the patient. And once again, go back to the cms.gov website. It's a kind of dense website, but there's a lot of good information there. Okay. Getting out, how to negotiate and understand your contract. You really have to do your research. What are you worth as a urologist? You need to look at national salary data, and then also if you can look at local data. I mean, if you come to New Mexico and you say, I want $800,000 for a salary, they're going to laugh at you. But if you look at other metropolitan areas where salaries are higher, you don't want to ask for too much, but you don't want to ask for too little. You need to look at the benefits that are offered through your contract, your malpractice, health insurance, time off, maternity leave, paternity leave. Look at those things. Some of these online resources will help with, what salaries are. Medscape will put out a salary. Doximity puts out this, also what people are worth. And the MGMA, Medical Group Management Association, they are a wealth of information about physician salary and how practices are run. So I would try and take a look at that. The other thing is find a lawyer. Don't try and do this on your own. We are medical professionals. We are not legal professionals. Know your limits. So they can help explain the legal jargon and let you know what's in the contract that you're signing. Although there's probably going to be a fee up front to hire the lawyer, it's probably going to be money well spent to either get you into a good contract or get you out of what could be a potentially bad contract. This is really important, and you've got to say it out loud. You got to figure out in private practice how the money works. It's probably the most critical topic for success in private practice. You need to understand your compensation model. How are you getting paid? What's the productivity? Is there profit sharing, risk sharing? Is your salary fixed? Is there a productivity bonus? You need to figure this out. This is critical, how to understand how overhead is allocated. Just because you bring in $1 million to a practice doesn't mean that's what you're going to take home. So what's your responsibility? What happens if you can't meet your overhead? These are critical things to know. Read the monthly financial reports. Most practices should get a report every month about what goes in, what goes out. You need to look at it and begin to understand where the money goes. The other thing is you have to learn how to talk to the accountant and figure out, if the practice is in trouble, what's going on? How can you bring in more money? How can you cut costs elsewhere? All right. How important your partners are. And this sort of echoes what Dr. Riley said. Your partners will either make you or break you. You will either have a great, successful practice or you will hate these people and go find another practice. It's hard, with a brief interview in a practice, but try and get to know the personal dynamics of the practice before you sign on. Are there older dinosaur guys that you're going to have to figure out how to work with? Younger Turks, what's going on? And then look at your expected role in the practice, and kind of understand how this is going to work, which leads into working on your emotional intelligence and developing coping skills to deal with difficult personalities. This is helpful not just for your partners, but it's also helpful for working with patients. And the more you understand your emotional intelligence and how you respond to other people is going to make you a better partner, and it's going to make you a better provider. Okay, how important health policy is. So, things that happen in Washington, D.C. will affect all of you. Things that happen in your state government will affect all of you. If you're forced to do something and you don't really understand why and it doesn't seem to make sense and it doesn't further patient care, it's government interference. And I think you have to realize that although it seems very remote, I live in New Mexico, I don't live in D.C., what happens there affects us. You need to get involved with urology advocacy groups. AACU advocacy group. The AUA has an advocacy branch. Specialty societies, ASTRO, all these other people have an interest in what's going on nationally. This sounds kind of odd. Consider joining your state medical society. If you can affect something at the state level, you may make your practice better. You can help things for your partner and everybody else in your state. And as we like to say in the advocacy world, if you are not at the table, you will be on the menu. Other things, going into private practice, you've got to deal with your hospitals. When I was in practice, we private practice, we covered 2 major hospital organizations. And I think it's really important to know your relationship with the hospitals that you're going to cover. I had a friend in Austin that was covering 5 or 6 hospitals. You need to find out what the hospital expects from you. What are your call responsibilities? And then the flip side is, what can you expect from them? What are you going to give me? Do I have to pay for my lunch? Can you give me free lunch? Something like that. The next one is key. How do you get block time in the operating room? Because as the new guy, your block time is going to be Friday afternoon at 12:30, and you're going to be in the hospital forever. And you kind of have to work with the hospital. How can you finesse block time? How can you move up on the OR food chain? This sounds kind of goofy, but get to know the people that are in the Office of Medical Staff Affairs. For the most part, they're decent people. And it's good to know them under good circumstances rather than when something bad happens and you are called into the office, like getting called into the principal's office. So know these people, try and get a good working relationship with them. Sounds kind of wacky. Serve on a hospital committee. I was on the credentialing committee for one of our hospitals, and it really educates you as the ins and outs, how people get credentialed and about the hospital politics. Okay, the importance of your urologic organizations. You need to stay involved with the urologic organization of your choice. As a resident or younger urologist right now, you're interested in this, but when you get out and you get into practice and your time is completely subsumed by all of this, you may let these kind of things slip. Like, I'm not going to go to the AUA this year. I'm not going to go to the section this year. Try not to do that. Go to the AUA. These people offer education, advocacy, CME, and networking. Networking is huge. If you're in a large but poorly populated state and you need something that you don't have, it's nicer if you've met somebody at a meeting, you can call them up and say, I've got this patient and I just don't know what to do, rather than trying to find somebody. So those contacts that you make at your meetings are invaluable. AUA is great. The AUA sections, there are 8 of them. They are a smaller, more intimate group. They are your regional people. Get to know them, network with them. It's going to be really helpful. AACU, we have a Young Urologist section. We want younger people to come in. We are interested in advocacy. We want to help move urology forward. LUGPA, Large Urology Group Practice Association. These guys are great. They work with larger practice. They are advancing more of the practice aspect of urology. Society of Women in Urology, and then looking at your own state urology society. 10 things I wish I knew. The work-life balance is a myth. This is a total myth. And this is the hardest part of the job. A stable work-life balance is virtually impossible. Things are constantly shifting. You need to set your priorities and stick with them. Is your family your priority? Is your practice your priority? Find what is the most important thing for you. You've got to create coping mechanisms to help with the imbalance, because someday you may have a family crisis and work may suffer, or it's going to be vice versa. You're going to have some family crisis and work is going to suffer. And you just kind of have to figure out how to balance that. It's a constant juggling act. Above all, value your spouse, your partner, your friends, or your family. You're going to need their support when your life is wildly out of balance. Other thing, call never gets any better. You think when you're getting out of residency, your fellowship, it's going to get better. It doesn't. The ER guys are still morons, and it's just going to be painful. So just remember that. Thank you.
Thank you for listening to the AUA Inside Tract podcast, an official podcast of the American Urological Association. For more information, please visit auanet.org.